We're just gonna note any differences. And weakness on one side can indicate injury or deformity to the anterior deltoid. Okay, that was good. So the next test we're gonna do is the shoulder extension strength test. So I'm having my athlete just sit backwards so we could have more of a visual on what this looks like, since I'm gonna be applying resistance just right here on his elbow as he tries to move his arm in an extension motion. So he's trying to move it back, but we see that it's a little weak, and this can indicate injury or just possible deformity to the posterior deltoid. And now we're just going to perform this on the other side. So we're just going to apply resistance right here as he tries to move it back, and we can see that this side is a little more stronger. Okay. So the next test I'm going to perform is the shoulder strength internal rotation test. So I'm just going to have my athlete have his arm at this side first. I'm going to have my athlete have his arm at a 90-degree angle. You could do a little bit lower. And what I want is I'm going to be applying resistance on this side, trying to push his arm outward while he's trying to push his arm towards himself. So we can start. Okay, looks good. And then I'm just going to do the same thing on this side with his arm at a 90-degree angle, applying resistance on the inside, trying to push outward as he's trying to push towards himself. But we see it's a little weak, and this can just, again, indicate some injuries. Okay, so now I'm going to perform the shoulder... Stop! Okay, so now I'm going to perform the shoulder strength external rotation test. So the same thing, similar to just internal rotation, we're going to have his arm a little outward, kind of at a 90-degree angle like this. But I'm going to be applying pressure on the outside, trying to push inward as he's trying to force his way outward towards me. So I'm pushing at him and he's pushing at me. Go. We see a little weakness on the injured side. This could indicate just, again, his shoulder strain. But we see that there isn't severe pain. So now I'm going to work on the other side. Okay, so we're going to have like this. And I'm applying pressure on the outside, trying to force in, and he's trying to force out. See, it's stronger. So I'm now going to be performing the shoulder strength abduction test. And a lot of these tests are just, he's going to be doing a range of motion exercise, yet I'm just going to be applying resistance. So for the abduction test, we're going to just have he's going to try to lift his arm to his side, but I'm going to apply resistance right here, having my arm on his forearm and one arm on his shoulder. Make sure to keep his back straight. So then now he's going to try lifting up as I apply resistance. Okay, and then now we're just going to perform this on the other side. So again, having his back straight and my arm at his shoulder. And one arm right here on his forearm. He's going to try to move his arm up as I apply resistance as he lifts his arm up. You can see it's a little weak, and this can indicate injuries. So now I'm going to be performing the shoulder test adduction test. So instead of upward, he's going to be trying moving his arm downward with some resistance by his side. So I'm going to have, with his back straight, I'm going to apply just my shoulder on this side, lightly. And then I'm going to put my arm just slightly under. As he tries to move it down, I'm going to apply resistance and try to move it upward. Okay, looks good. And then on this side, we're just going to do the same thing. And we're just going to have my arm slightly under as he tries to move down. Just a little bit of a difference, but we can see that his left side is still stronger than his right side. So for this next test, we're now going to do the empty can strength test. And for this test, we're going to have my athlete just sitting down with his arms by his side at first. And now we're just going to move his arm at a 90-degree angle. It's like this. But then we're going to keep it also 30 degrees. So just slightly like this. And then, so my athlete's going to have his thumbs in place. And he's just going to try to move his arms internally as possible. But I'm going to add resistance, trying to stop this. And he's just going to push down, trying to go inward. So he could start. Okay, we see his right side is a little weak as his left side was able to avoid the resistance. Evaluations from the manual strength test is that still his right shoulder is not able to apply the full force against the resistance and is still a little weak, but yet we still see there is an extreme pain, and this rules out many injuries. So right now we are suspecting that he just has a muscle strain in his shoulder. So now for the specific test that we're going to perform now is the drop arm test, and we're just going to perform it on his right shoulder and his left shoulder and just compare the results and then advise some treatments afterwards. The specific test that we're going to perform on my athlete is the drop arm test. So I'm going to have my athlete's arm outstretched by his side like this, and I'm just going to hold the area just above his wrist and under his bicep area. So I'm just going to be holding it, as you can see, but what we're going to watch out for is if his arm is unable to control the downward motion. So as I let go, we're just going to see the dropping arm motion as he is unable to control. So as you can see, his arm dropped a little as I let go. So now we're just going to compare this to the other side so we can see if there's a difference. Thank you. And I'm just going to be holding it again like this. And then I'm just going to let go. So as you can see, he had no difficulty holding his arm. So we can suspect that my athlete has sustained a muscle strain injury on his right shoulder. To conclude, it is evident that our athlete has sustained a muscle strain injury to his rotator cuff tendons. So my best advice for him was to just do the RICE procedure, which is rest, ice, and compression. And he should stay out of any athletic activities until he feels better, so to ensure that he doesn't re-injure it. Okay, thank you. Bye.